Hello, and welcome to the 47th Annual AAKP National Patient Meeting. I'm Carlos Copeland, a proud AAKP Ambassador for the state of Georgia. I was diagnosed with kidney failure in February of 2013. As a result, I chose to do peritoneal dialysis at home for over 4 years. My goal was to receive a kidney transplant, so throughout those years, I did everything possible to transplant and shared my story publicly. After seeing a social media post expressing my need for a kidney transplant, an altruistic donor was moved to donate one of her kidneys to me. In September of 2017, I was given a kidney from this living donor. As an AAKP ambassador, I share the AAKP message that every kidney patient has a choice and a voice. It's imperative that every person has access to all available treatment options and, in coordination with their healthcare team, develop a care plan that supports their individual goals and aspirations. As a patient advocate, I've spoken on local news programs, radio stations, and community events sharing my journey with kidney disease. In 2018, I was excited to appear on the national TV game show Beat Shazam with Jamie Foxx to share my story nationally. More recently, I was honored to be a part of the AAKP Peer Mentorship Program funded by PCORI Engagement Award to mentor fellow kidney warriors in coping strategies when faced with a chronic condition, as well as to discuss all treatment options available from the patient's perspective. My goal is to inspire others to live their best life despite kidney disease. For our session entitled AAKP Delicious Eating, Kidney-Friendly for Optimal Health, I'm pleased to introduce one of our AAKP's own, Miss Sara Schaeffer. Sara is an AAKP National Board of Director, Vice President of Strategic Operations at Healthmap Solutions, and a registered dietitian. Sara, I turn things over to you.
Thank you, Carlos. My name is Sara Schaeffer. I am happy to be here today to present on the AAKP Delicious Eating Kidney Friendly for Optimal Health. I am in fact a registered dietitian and a proud member of the Patient Majority AAKP Board of Directors. We understand that dietary needs are unique per patient and per individual and often change over the course of your health. This session is really meant to give you some basic tools and tips to eat kidney friendly, understand what that means, who to work with on your healthcare team, and the importance especially of working with a kidney dietitian. We'll go over some real tools and tips like reading labels and ingredients, understanding portion size, and really here my job today is just to get you a little bit excited for nutrition and to give you some hope and motivation to stick with it. Again, thank you for attending the 47th Annual Patient Meeting. It's my absolute pleasure to be here today. Here is an agenda of what we're going to talk about. Again, it's really just a brief overview about nutrition and food intake on the kidney diet. It can sometimes seem restrictive, but we'll talk about some of that today. So the first thing is we'll talk about nutrition across the stages of kidney disease. We'll talk a little bit about what kidney-friendly means and how we might look to balance a kidney-friendly diet with some of the other health conditions or goals we have in our lives. We'll talk about the care team, specifically dietitians. We'll also go over just a few tips and tools, again, like reading ingredients and food labels, just to give you some things directly from this session. We'll also go over an AAKP resource on eating friendly. I'll give you my final thoughts and we'll close out for the day. As I said in the opening, food and nutrition is very specific to each individual. So therefore, this is not medical advice. Please listen to your body, your care team, your doctor. But we'll start here with the stages of chronic kidney disease and the impact that might have on someone's nutrition. When someone is in chronic kidney disease stages 1 through 4, we typically ask that people limit their sodium intake. Some may limit their protein intake, and often the DASH diet is recommended. So Lowering our sodium intake is really, key for all of us. The average American eats about 3,400 milligrams a day. And for example, the DASH diet really limits that to 2,300 milligrams a day. Some people are asked to limit their protein, as that can be difficult on the kidneys to process, and therefore it might slow the progression across CKD. And then that DASH diet, it stands for Dietary Approaches to Stop Hypertension. And that's really a general healthy eating plan designed to treat or prevent hypertension. It includes foods that can help control blood pressure, and again, it's limited in sodium. Once we talk about nutrition in stages 5 or end stage renal disease or end stage kidney disease or transplant, it becomes very specific. And so when someone is on dialysis, it might be a hemodialysis, whether it's at home or in center, or it might be peritoneal dialysis, which is, the tube in the belly that uses the membrane to filter out wastes. Really, there's very specific nutrition that is dictated by your care team, things like, watching your fluid intake, consuming high quality protein, perhaps phosphorus binders during mealtime, and then also watching your potassium. But again, that's very specific once we get to dialysis, and so it's very hard to speak generally about that. And then when we think about transplant, we also think about nutrition and transplant before receiving the transplant, perhaps to lose weight, to make for a less complicated surgery, or nutrition after your transplant, depending on the medications and your body's reaction to the transplant. Again, for all of these stages and nutrition recommendations, really please be sure to talk to your care team about your individual needs. These are really just broad strokes over a very individualized topic. I'd like to start by talking about kidney friendly and what that means. And so kidney friendly is not a standardized definition, right? It doesn't mean the same thing for everyone, but it is a term that we generally use because, as I said, although it's very individualized, there are some basic guidelines that apply to most people. And as I go through these, I think you'll see that a lot of these are really just general healthy eating and could apply to all of us, myself, our families, a lot of guidelines that we all should think about. And so the first one is less salt. And so, as I said previously, right, the average American eats about 3,400 milligrams of sodium in a day, which is a fair amount. A lot of that's from processed food. It doesn't just all come from the salt shaker. And so reducing our salt intake is usually one of the first steps when we talk about a kidney-friendly diet. Another one is less sugar. So there's a lot of added sugars in our foods. I'm sure you're aware. Even things that you might not think have sugar in them, perhaps like lunch meat or tomato sauce, often have added sugar. And so especially for someone who might have diabetes or, is on the cusp of having, poor blood sugar control, in general, consuming less sugar is considered kidney friendly. And then we want to talk about protein, right? And so again, depending on where someone is in their stage and their medical team's advice, we talk about right protein in the right amount. And so that could be animal or plant protein. There's a lot of interest right now in plant protein and its healthy effects, for folks with kidney disease. Either way, we're really thinking about, if you're in pre-dialysis, those earlier stages of chronic kidney disease, your care team might talk to you about eating less protein because eating more protein can make your kidneys work harder. If you're on dialysis, whether it's peritoneal or hemo, you might need more protein because some of those building blocks for protein are lost on dialysis, and that eating that protein helps our immune system and a lot of important functions. And then we think about kind of like just right needs when someone is perhaps stable after they've been transplanted, finding a protein level that really matches what their activity needs are, and then also their kidney function. And so to continue these kidney-friendly ideas, we also think about heart-healthy habits. Again, this would be the same general advice for the average person too, right? We all could adopt heart-healthy habits. That means eating lower fat, avoiding trans fats. Those are things like a lot of fried foods and baked goods and saturated fats. And then also, not overdoing on the alcohol. And so really low alcohol intake is, 1 drink a day for women and 2 for men. All of those things are heart healthy. It's important to be aware of phosphorus, and so to choose lower phosphorus foods and drinks. This is good for most of us. Phosphorus plays an important role in bone mineral metabolism. There's so many things that are going in our bodies we don't even think about, and phosphorus is kind of one of those things. We don't think about it often, but it can have a huge effect on your bone health and even your heart health over time. The last two that we want to talk about are potassium and fluid balance. And these are highlighted because these two, more than perhaps the others, can have a more immediate or effect on your health. And so knowing your potassium, whether you're asked to eat a high potassium diet or a low potassium diet, it's important to understand where potassium is found, mostly fresh fruits and vegetables and some additives, so that you can match the potassium intake that you need. Potassium helps affect your heart and the way your muscles contract. And since your heart is just a big muscle, that potassium and understanding that is really important. And then the last one there is fluid balance. Again, this one is also highlighted because it can have an immediate effect on your health. If you've ever had, an episode where perhaps you felt fluid overloaded or you had, too much volume on, perhaps you're not urinating anymore, understand that fluid balance and how much you can drink or take in and how much you're getting rid of, whether it's through dialysis or urination, is important to understand and ask about, ways to manage your fluid balance. And so in the similar idea, a lot of times people ask me when I was a registered dietitian, particularly, how do I balance all of these things, right? I want to do the right thing for my chronic kidney disease diet, but hey, also I might have hypertension or diabetes. I want to lose weight. I want to gain weight. I want to be able to enjoy family meals. There's certain things we do around the holidays or patterns, eating patterns. And frankly, it is and it can be a lot to balance. And so please don't be discouraged. There's a way to make all of that work. And again, a lot of these things, these kidney-friendly diet and nutrition ideas really are good for all of us. And so if we take these on as a group or in our family structure, it can really provide that support. And we want to balance all of those things, right? Our disease and our health state and our family and cultural eating patterns with the advice and with the care that we receive from our care team, our dietitian, our nurse, our doc, and then objective data, what your labs are like, if you're trying to gain or lose weight, what medications you're on, and how you feel, right? And so a lot of this is kind of subjective, but it's important to tune into that and to share all of these things. And we'll take the next few minutes to talk about a care team and how we can align some of those goals, their input and your input to find something that works for you to meet your health needs. And so we often talk about your care team. And so just wanted to take, one slide here to just really list out who that is. And so we think about, certainly our doctor, whether that's our primary care physician, certainly our kidney doc or nephrologist. If you're seeing other docs for other conditions, it's important to share with all of them and ensure that they are collaborating on your health to meet, your health goals. And then also we often think certainly about our nurses. They play a key role. It's a group that, patients, we spend a lot of time with the nurses, whether we're on dialysis or we're, getting worked up for transplant. You're going to have a pre or post coordinator. We're usually nurses. There's social workers on your care team, another wonderful resource, amazing individuals who can really help connect you to resources you might need. This might include assistance with bills or mental health concerns. And then, of course, lastly, but not least, the dietitians. When it comes to kidney care, registered dietitians are a huge support. Most of us are huge kidney food nerds, and we just want to help people and, to really work with us and share what you need, what's going on, so that we can come up with a real life plan for you. And then, of course, don't forget you. You are the most important person on your care team. You are really the QB of this team. You know your body, you know your goals, you know your home life. And so please don't forget that you really are the most important person to be at the center of your care team. Empowerment, engagement, shared decision-making, all of those things, are really all within your locus of control as you move through this. So please don't forget that you are the most important person on your own care team. And, since we're talking about food and nutrition, and I'm a registered dietitian, we just wanted to take a minute to talk again about kind of the role of dietitians. And we'll also talk about how you can find one. So, really, it's super important to work with specifically a kidney dietitian. And so, dietitians, we go to school for this. In undergraduate, we have to take an internship where we work real life in a hospital and outpatient and actually food service positions to really understand the continuity and really the whole spectrum of healthy eating and food preparation. And so it's a very specific thing. And so you should always talk to and work with registered dietitian or a registered dietitian nutritionist. Those credentials let you know that that person went through formal training, they sat for a national board, they maintain a licensure. Almost anyone can call themselves maybe a nutritionist, but it doesn't mean that they went through that same rigor. And then when you are working with a registered dietitian, we all want a gold star. We all want to, do right. And nobody wants to admit that last night, maybe I had 7 chocolate chip cookies because I was stressed and it was late. But, please be open and honest with your dietitian. We are not the diet police. We have the same struggles. We understand that perhaps you ate more cake at a kid's birthday party than you planned to, or you want to eat this, or, whatever it is. Please just work with us and be real. We will find a solution, but we really can only do that if we're all kind of, forward facing and sharing kind of the real deal. And then lastly, everyone loves talking about food nutrition. It's a big part of kind of our culture, right? It's a part of celebrations and sharing recipes. It's a community and a bonding topic, but just consider the source. If you're seeing a registered dietitian as part of your care team and your neighbor says that maybe you should start doing this, that, or the other, or take these pills, it can be appropriate just to say, hey, thanks for the advice, and then maybe follow the advice instead of your care team. Just a little reminder there to consider the source. That comes to individuals, but also organizations. And so looking for information online, places like AAKP and professional organizations, patient organizations are really the best source of information for anything food and nutrition. And so we'll have the deck out there, but we wanted to share a link to be able to find a registered dietitian. And so here, this is the page. The address is at the top. It's from the Credentialing Association for Dietitians, and it's how to find a nutrition expert. So I'll just quick walk you through the page. And so once you click on this site, the very first choice is in-person or telehealth. Especially since, COVID times, telehealth has really taken off and become, a staple of healthcare. And so if that appeals to you, if you have the wherewithal to do that, that's certainly an option. So you can click there in person or telehealth. And then below that, you see specialty, insurance, and language. Here for this example, I just chose, insurance for state Medicaid. That'll give you providers that apply services under those conditions, whether it's a specialty or a language or insurance. And then you'll see that just click the Find Now button. And then down at the bottom, it will populate all the professionals that meet the criteria and then their contact information. So you can see there they have email addresses and or phone numbers to reach out if that's something that you're interested in. So we're going to take just a few minutes to go over a couple tips and tools. Certainly this is not all that's out there with our smartphones. There's so many apps and tracking, but we're going to just start with a couple of the basics just as a reminder. And so this first one is really the nutrition facts label. So it's pretty exciting for those of us, in the field that in 2022, they really changed the requirements for the nutrition fact label for serving size. And so by law, the serving size has to be based on the amount of food people typically consume rather than how much they should consume. So before, a serving size might be 1 or 2 Oreos. I don't know about you, but 1 or 2 Oreos is not usually my serving size. And so they've been updated. And that was updated through nationwide surveys from the amount of food that Americans eat. And so that's the very first one. And just understand then that you might have to do some math. If serving size in this example is 2/3 of a cup and you're eating twice that amount, you have to double all of the calories and the fat and all of the numbers there. So again, just the first place should really be that serving size and just check that against your reality. So here, this example, this package has 8 servings. Again, that idea that if you ate more, we have to multiply all of these other numbers by what you ate. Total carbohydrate shows the types of carbs in the food, and that's sugar and fiber. So as I was saying in the basics of kidney disease, that total sugars, really look for that added sugar, right? That's the component that we're really seeing a lot of, unnecessary sugar consumed through that added sugar. And then if you go down, below that, you can see some of the basic minerals and fibers and protein. So again, those facts can help you plan the right diet and intake for whatever your health goals are, wherever you are in your kidney disease journey. And then, right, in general, again, just that plug there for choosing foods that typically have lower calories, less saturated fat, less sodium, and less added sugars. And so not only on a food product are we going to see the food label, there's also certainly going to be the ingredients list. Now, granted, we don't all read these maybe in the grocery store. Over time, you find something that meets your health needs and is also tasty, and so you don't have to read it every time. But when you pick up a new product or you're trying to kind of define what works for you, a good one is the ingredients list. So it's listed right from highest to lowest. And then again, as we were talking about earlier with phosphorus and potassium, it's really those additives that we want to try to avoid, especially because additives are typically absorbed at a higher rate than naturally occurring. So if there's phosphorus in beans, for example, and there's also a lot of added phosphorus in Lipton's brisk iced tea, your body is going to absorb that Lipton's, brisk iced tea phosphoric acid at a much higher rate than, say, the kidney beans. And so the thought here is to try to avoid the foods that have phos in the ingredients. So 2 examples here might be phosphoric acid or disodium phosphate. You don't have to know what those things are or why they're in your food. Frankly, most of us don't, but they are things to avoid. And then similarly with that potassium, right? It's important to know if you should be eating high potassium or low potassium. Either way, knowing, the ingredients in your food, if they have these potassium additives, such as potassium chloride or potassium sorbate, helps you make an informed choice as you plan your food and diet intake. And so, another one kind of piggybacking on the nutrition facts label and portion sizes, really the best way is to measure or check. But a fast example would be to use your hand. And so you often, you might see this, or your dietitian might have told you this before, but your protein should be about the size of the palm of your hand. That's about 4 ounces. If you think about your thumb, the tip of your thumb is about a tablespoon. So that should be, you're thinking about higher fat or treats, it should be that smaller amount, like your thumb in a tablespoon. And then if you think about your closed fist, that's about a cup of food. Again, for example, if we were thinking about perhaps cooked pasta, 1 cup of pasta might be the size of your fist. Think about realistically how many cups of pasta you're eating, and then, what that might mean for your carbohydrate intake. So in general, most of us underestimate our portion sizes. I know I'm guilty of this too. It's a little bit easier, like the Oreo example. If we're saying like a serving size is 4 Oreos, you can count those out. But, something like cereal, breakfast cereal, or pasta or rice, those are things that are a little bit harder to have a good feel for. And so we do recommend occasionally measuring or weighing your food just to check in kind of with that reality. And once you are able to have an eyeball of, what the portion sizes are, you certainly don't have to measure or weigh all of your food, but it's a good kind of reality check for all of us occasionally to get in tune with what real portion sizes are. And then, of course, all of this really matters, as you've kind of probably figured out, that a low food, say a low potassium food, becomes a high potassium food if we eat a lot of it, right? So it's the same with carbohydrates. Carbohydrates are not bad for us. Potassium foods, depending on what your needs are, it's really just being aware so that you can make those choices. And so understanding portions helps us with, quote unquote, low and high foods. And so this often comes up as well, hey, I can only afford canned fruits or canned vegetables, is fresh better than frozen? What about organic? While I don't have organic on here, typically, right, we say organic is great. There are certain foods that, are better eaten organic, but honestly, it's better just to eat fruits and vegetables, especially if it's a cost thing, than to, have to spend the money on organic. So we think about fresh, all fresh is good. There's really nothing else to think about. As long as it fits into what your eating pattern is and what you need, that's fine. Frozen, also good. No extra really considerations there. You can use it just like fresh, follow the portion sizes. Canned gets a little bit trickier. We do usually recommend for a kidney-friendly diet that you choose a low salt option. And so now a lot of things, whether it be soup or canned vegetables, offer a lower salt, and it's usually a pretty good chunk of sodium that's saved. We also often recommend rinsing canned vegetables, particularly, again, to help kind of wash out some of that sodium. If you're doing canned fruit, you want to think about that added sugar, right? So there's a big difference between canned peaches and heavy syrup and canned peaches in, white grape juice, right? So again, you want to think about kind of the things that are added to our canned fruits and vegetables that make them last, but are also, that effect on our health. And then I added dried fruits on here. It doesn't come up as often, but they're often, they're very handy, but you do want to think about dried fruit. Again, a lot of added sugar. Dried fruit can seem like a great option, but check that ingredient list. Apples, it might be apples, sugar, right? It's very obvious. So just consider that. And then also portion size. We have a tendency to eat more because it doesn't have all that fluid. There is a tendency perhaps to eat more dried fruit than we might eat, fresh fruit. I wanted to highlight AAKP's kidney-friendly recipes. AAKP Delicious has been very successful over the years with, lots of different volumes and episodes of that. And so the link is up there at the top. When you orient yourself to that page, you can go over to the drop-down for Centers for Patient Research and Education. And then it's kidney-friendly recipes. If you choose that, it will take you to the page you're looking at. And then you can scroll down to the bottom to see the AAKP Delicious by volume recipes. The link that I shared a while ago for the renal dietitian is also on this page. So if you only get to one place, you can get to this page, and this will take you to the Find a Registered Dietitian, another great resource that's out there. And then there's links from this page to other kidney-friendly recipe sources like Northwest Kidney Centers and some of the bigger dialysis providers. So, really in conclusion, my final thoughts here is really just to not be overwhelmed. What we as registered dietitians, we never want somebody to get really excited about food nutrition and then go home perhaps and clean out your cupboards or buy all new foods because, it's really hard to stick to, right? We're all creatures of habit. So, we really ask if there's something that resonated with you today, you heard something, you're like, oh, I should really get better with my portion sizes or learn more about potassium. Pick one small thing, pick one small change at a time. Do that enough times that it becomes a habit, and then later it'll just become the new normal, right? And so we often don't like to say diet, right? We like to think about a lifestyle change. A diet, most of us picture something that you're on and off and it's ups and downs, but a lifestyle change to eat more heart healthy, to eat, less fat, or, more of the right fruits and vegetables. Pick one small thing, and change that until it becomes a new normal. Everyone has diet challenges. Certainly we understand that the kidney diet can sometimes, feel and seem more restrictive, but, we live in a land of plenty, a lot of cheap food, available food. And so really it's on all of us to kind of stick with our diet and our nutrition. We all, especially around the holidays or certain times of the year, we backslide a little bit, take it easy on yourself, just prioritize, work with your care team, and just understand that, you're doing this for you and your future, but you're not alone in having, diet challenges. And then one of my favorite examples for all of this is think about brushing your teeth, right? If you brush your teeth once, that's not really going to make a difference for your overall dental health, right? Say you brush your teeth once a day and you go to the dentist. Okay, that's pretty good too. But, it's really that consistency, right? Brushing our teeth, flossing twice a day, every day, and going to the dentist, one time might not seem like much, right? Like one kidney-friendly diet, or one kidney-friendly meal might not seem like much, but over time, it's really that consistency that builds long-term healthy habits and can have a long-term effect on your health. And so just, my closing here is to really embrace the good, embrace yourself, celebrate the things that you're doing right, stay hopeful through those tough times, lean on your care team, really just be real with them about, what you're going through and what you need. You can do it. Thank you so much for your time and attention today. Really pleased to be here and hope that you found something useful from this and you continue to be a part of AAKP.
Thank you, Sarah Eve, for a great presentation. Diet and nutrition can be complicated for individuals with kidney disease, and there's no one-size-fits-all meal plan. But your insights will help everyone eat kidney-friendly. For more information about eating kidney-friendly and for AAKP Delicious recipes, please visit the website that's showing at the bottom of your screen.